All right, today we're diving into something pretty wild, the secret language of our skeletons. We're going to see how, through the lens of radiology, our bones tell these incredible stories about our lives, our health, and even our future. I mean, have you ever really thought about it? What if every single bump, every shadow, and every little line on an x-ray wasn't just anatomy, but a word in a sentence? A sentence that's telling a story. Well, the thing is, they absolutely can. The trick is just knowing how to read them. You can think of radiologists as expert translators of this secret language. So, for the next few minutes, let's learn some of the lingo and see what our bones are trying to tell us. Okay, first up, let's talk about what happens when bones, well, when they grow extra bits. In radiology, it all comes down to recognizing patterns. And you'll see, sometimes the simplest patterns are the most powerful. It's kind of like a world of rule makers and rule breakers. So, meet the ultimate rule maker, the osteochondroma. This is the most common benign, non-cancerous bone growth out there. You might also hear it called an exostosis, which is really just a fancy way of saying extra bit of bone. And it follows one super simple, super predictable rule. It always grows and points away from the nearest joint. Got that? Away. That direction is absolutely key. Okay, so if that was the rule maker, now we've got a rule breaker. This is Trevor disease. Now look, it's basically the same kind of growth, but here's the twist. It happens in a child's growth plate. And it breaks that one crucial rule. It points into the joint. And that one little change in direction, it changes everything. It can cause some pretty serious problems, even deformity. It's a perfect example of how in radiology, the exact same growth pointing a different way tells a completely different story. And get this, here's another rule breaker, the supracondylar spur. It also points towards the joint, but it's a total red herring. This thing is completely harmless, just a normal variation. So you're probably asking, how do you tell it apart from the bad one, from Trevor disease? It's all about location, location, location. Its classic spot right there near the elbow makes it a dead giveaway. So it's not just the direction that matters, it's the address too. Spotting these patterns isn't just about finding what's wrong. It's also about knowing when to just leave things alone. And that brings us to a really critical skill in radiology, seeing things that look weird but are actually totally fine. It's all about learning what not to touch. And radiologists have this awesome piece of slang for this. They call it an Aunt Minnie. The idea is it's a finding that's so classic, so unmistakable, that you recognize it instantly, just like you'd spot your Aunt Minnie in a huge crowd. The diagnosis is made the second the image pops up. No question. So here are a few of these classic Aunt Minnies, these don't-touch lesions. You've got the cortical desmoid. It kind of looks like a scoop was taken out of the back of the femur, right? But nope, it's just a little mark from a tendon pulling on the bone. Then there's osteopoikilosis. You see these little white clusters of bone islands, but they're totally harmless. And osteofibrous dysplasia, that's a benign thing you find almost only in the shin bone, the tibia, of young kids. They all look a little strange, but the story they're telling is one of complete normalcy. Okay, now we get to the great imposter, the absolute master of disguise in the bone world, Paget's disease. This thing is the ultimate shapeshifter, and it's just a fantastic way to see how one single disease can tell so many different stories. And don't think this is some super rare, obscure thing. It's not. Get this, by age 80, it's estimated that 8% of people are affected by Paget's disease. A lot of them don't even have symptoms. Their bones are just quietly telling this really complex story without them ever knowing. So why is it such a shapeshifter? Well, it's because it goes through 3 totally different phases. First, there's the lytic phase, where the bone actually breaks down. Then it goes into this chaotic mixed phase of repair. And finally, it can settle into this hardened sclerotic phase. And each one of those phases looks completely different on an X-ray. So let's look at its many phases, right? In a long bone, that first phase, the bone-destroying lytic phase, it creates this dark area on the X-ray that radiologists call a lucency. It looks like this sharp, advancing flame, and it has this incredibly poetic name, the blade of grass sign. And in the skull, that very same process creates these big areas of bone loss, and they call that osteoporosis circumscripta. Then, when the disease flips into that chaotic mixed phase, the repair process just goes nuts. And this creates the classic cotton wool look, with these thick, messy, disorganized bone structures inside. And finally, in the spine, the outer layer, the cortex, can get thick on all 4 sides. This creates what they call the picture frame vertebra. So here's the really wild part. All four of these signs look totally different, but they all point to the exact same disease. Yeah, that picture frame sign is a perfect lead-in to our next section. The spine is kind of like a canvas where all these different systemic diseases leave their own unique signature. It's time for a final showdown of patterns. And this just lays it out so perfectly. Paget's gives you that picture frame on all four sides. Okay, but look at renal osteodystrophy. That creates these thick, dense bands only on the top and bottom of the vertebra. It looks like the stripes on a rugby shirt, which is why I call it the rugger jersey spine. And then you have sickle cell disease. Because of issues with blood flow, the center of the vertebra can collapse, creating this totally unique H-shaped vertebra. See? 3 different diseases, 3 completely unmistakable signatures in the spine. So, up to now, we've been looking at how the bones themselves change. But what happens when the story doesn't start in the bone at all, but in the blood that's supposed to be feeding it? Let's dive into what happens when bone health is shaped by what's flowing through your veins. A really dramatic example of this is avascular necrosis, or AVN, of the hip. The name tells you exactly what it is: bone death without blood. For a bunch of reasons, could be steroid use, or sickle cell, or even an injury, the blood supply to the top of the femur just gets cut off. And without blood, the bone tissue dies. Simple as that. Now, this whole process happens in stages. In the very beginning, an X-ray might look totally normal. As things get worse, you start to see these mixed changes, some breakdown, some hardening. But the real turning point, the most critical moment in this entire story, that happens in stage 3. And that moment is when the crescent sign appears. It's this tiny, subtle, dark line right under the cartilage of the ball of the hip joint. I mean, it looks like nothing, right? So small, almost insignificant. But what it means is monumental. It is the sign that the dead bone is about to fracture and the entire hip joint is facing imminent collapse. It is one tiny line that tells a story of huge, huge consequence. So when you step back and look at it all, from growths that play by the rules to the ones that break them, from shape-shifting imposter diseases like Paget's, all the way to a single, subtle line that predicts a catastrophic collapse, it's clear that our bones are speaking this incredibly rich and complex language all the time. You see, reading these signs isn't just about making a diagnosis. It's about understanding a story, a narrative, written in calcium and marrow. It's a story about how we move, our genetics, our life itself. It really makes you wonder, doesn't it? What story are your bones telling right now?